Mr. President.
Senator from Nevada.
Thank you, Mr. President. So I rise today to speak in favor of the Vitter Amendment to the Energy Efficiency Bill. But before I begin my remarks, I want to first recognize the horrific events that occurred yesterday, just a little over a mile from here. Yesterday's tragic and senseless shooting devastated families and changed lives forever. We continue to hold the victims and their loved ones in our thoughts, and we are deeply appreciative of law enforcement and first responders who helped save lives and to prevent further violence. Mr. President, Senator Vitter's amendment to the Energy Efficient Bill addresses a serious concern that I, along with many of my constituents, have expressed about Obamacare. Specifically, this amendment seeks to eliminate special Washington, D.C. exemptions in the current law. It requires congressional staff, including the committee and leadership staff, as well as the president and the vice president and all political appointees in the administration to participate in the same exchanges that Obamacare forces on everyday Americans. I've co-sponsored this amendment with some of my colleagues, including Senators Vitter and Enzi, because I think it's clear that the American people are fed up with the Beltway mentality that the rules apply to everyone else, but not Washington, D.C. If you ask me, a law that applies to all Americans except those who wrote it simply does not pass the smell test. By the way, I want to note that this elitist attitude isn't anything new. In fact, America's second president, John Adams, warned against a legislative assembly that would, quote, in time not hesitate to exempt itself from the burdens which it will lay without shame on its constituents, unquote. It turns out this was a tragically accurate prediction. Before Obamacare was even passed into law, I've argued that those who wrote the law should be beholden to it. As a member of the House Ways and Means Committee, I introduced an amendment that would require all members of Congress and their dependents to obtain their health insurance through the Affordable Care Act's health care insurance exchanges. But last month, immediately after Congress left for August recess, the Office of Personnel Management announced in its proposed rules on Obamacare that the government can continue to make employer contributions to the health plans of congressional members and staff. This basically means that members of Congress and congressional staff will receive a taxpayer-funded subsidies for their health care insurance. Ultimately, these tax dollars will be used to protect Washington insiders from the negative consequences of Obamacare's health exchanges. Following OPM's announcement, I immediately wrote to them asking that they clarify in their final rule exactly who is subject to the exchanges. Specifically, I asked them to ensure that in addition to members of Congress, all congressional staff, including committee and leadership staff, as well as political employees, go to the exchanges. I've written a follow-up letter to OPM, and as of yet, I have not received a single response for this concern. Mr. President, if Obamacare is such a good idea, why wouldn't those who helped write the law stand proudly by it? The fact that Obamacare protects a select few from participating in its exchanges is further evidence that the law never should have been passed to begin with. But now that it has been passed, upheld by the courts as a massive tax increase, those who put it in place should be subject to the same burdensome regulations, taxes, and mandates that everyday Americans are stuck with. If the President and Congress says it's good enough for the American people, then it should be good enough for the President, Vice President, political appointees, and all congressional staff too. So this amendment that I've co-sponsored ensures that there's no special fix or exemptions for members of Congress and their staffs. It assures that they participate in the exchanges just like every other American starting January 1st of next year. It also ensures that any type of taxpayers-funded subsidies that is offered to them is also available to the American taxpayers through tax credits. Just like many of my colleagues, I spent August recess meeting with my constituents, listening to their concerns. Probably won't surprise anyone that the general public doesn't think very highly of Congress. And with this exemption, it is a perfect example why that's the case. Unfortunately, in recent days, the conversation about this particular amendment has taken an ugly turn towards personal attacks. Regardless of whether my colleagues support this amendment or not, we should be talking about this measure in the context of what's fair and what's best for the American public. I urge my colleagues to abandon threats and personal attacks and examine this legislation based on its merit. Since the Supreme Court upheld Obamacare, its provisions have been repeatedly delayed by the administration, demonstrating that the federal government understands how bad the law will be for businesses and middle-class families. In fact, the Washington Times just reported that the Obama administration has delayed major aspects of health care law no less than 5 times to date. And this latest move to insulate D.C. insiders from this unpopular law is more than enough evidence that Obamacare is the wrong answer to the health care challenges in this country. So I urge my colleagues to support this amendment. It's a reflection of a basic principle of our democracy, that equality under the law means the law applies to everyone. Serving the people of the United States is a privilege. It's about service. It's not about status. And if Congress is going to pass laws that are unpopular, we'd better be ready to live by those same rules as everyone else. This is what this amendment is about, and I hope my colleagues will join me in supporting it. Mr. President, thank you.